I'm Dr. Srinath Kumar, Senior Consultant, Head and Group Coordinator for Emergency Services, Narayana Hrudayalaya, Bangalore. In the emergency department, what we do when you come in with a diabetes, hypertension, stroke, pain abdomen, or any other kind of illnesses. Like, you may come with a simple history of a fever. So those times, what you're supposed to do, if you're coming in with a simple history of fever, we will take care of the symptoms and why the fever is occurring during that occasion, and what are the things we have to do during you get a fever. And as a common public, you have to know that fever is a common symptomatology and it is not an illness by itself. So when you come in, we look into the diagnosis and then start the appropriate treatment. If a patient is also having a diabetes, whenever the sugars are high or low, they come to the emergency services. When you are with a low sugar, you come in with sudden history of loss of consciousness and you become panic in those situations. Such a situation, you should keep some sugar water in your house, which will help to give sugar. But if the patient is unconscious, then you should not give him while he is lying down. You should bring the patient to the hospital. And what we do in the emergency department is we check for the sugar and start the patient on 25% dextrose or sugar, what has to be given for the patient. And usually the recovery is within few minutes and you can see it very commonly. And if it is same happening in your house and it is very far away, we would like to advise you to have a glucometer, check for the sugar, and if the sugar levels are low, either you can make him sit down and give some syrup, sugar syrup, or you can take to the nearest hospital. If the sugars are high, usually the patient will not lose the consciousness. If it is very high, only then they may have certain level of consciousness loss. So in those situations again, they have to be brought to the hospitals where we check for the sugars, and usually what happens is they will also alter the metabolic state of the patient. So we give the treatment for the sugar as well as other metabolic illness what the patient is coming with. BP, blood pressure. It's a very, very common kind of a illness in many households. They say that 1 in 5 or 1 in 6 households have this blood pressure issues. Whenever the blood pressure is again high or low, they will become either unconsciousness or subconscious levels. So in the same way, these are the patients who has to be brought to the hospital and the treatment has to be started. So if the blood pressure is high, we ensure that we give the medication to lower the blood pressure. But what is the issue is, as a common man, you have to know that not every time when a blood pressure is high, you have to give the medication. Sometimes it may be associated with a heart attack or a stroke. So in such situations, you should not give the medications to reduce the blood pressure. They have to be brought to the hospital where we can check for the blood pressure and do accordingly. The other important thing is fevers. Many fevers these days end up with a complex situation which we call in our medical terminology as sepsis or septic shock. Worldwide, it is said that septic shock patients, when they present to the hospitals, there is about 50 to 60% of mortality. So that is why, as a common man, you should know that whenever there is a fever for more than 3 days or 4 days, it is better to show to the nearest hospital and get checked it up before it ends up with a situation called as septic shock, wherein the treatment will be very aggressive and the patients will be needing antibiotics of different varieties, where sometimes they may require intensive care unit facility also, because these infections can reduce the blood pressure and increase the heart rate. So whenever the blood pressures are reduced, then again the treatment patterns has to be done in an intensive care unit. Now coming to chest pain, very importantly, these are the common causes. These are also called as non-communicable diseases because these are the one which is taking the deaths very commonly. Chest pain, it can be because of cardiac causes or non-cardiac causes. If it is a cardiac or non-cardiac, you may not be able to differentiate. It is better to go to an hospital and show it up, because we at Narayana are been seeing at a younger age group of 20 plus years getting an heart attack. You don't think so that only that people with 40 years or 50 years only get heart attacks. So it is better to go to the hospital, get an ECG done and see that the ECG is normal. If the ECG is abnormal, there are various other things to be done, like an echocardiogram or cardiac specific enzymes, where a cardiologist or a cardiac supported hospitals only can help those patients. So the common man has to understand that these are the things where they have to keep in the mind and do the things appropriately. They should not take it lightly, saying that, okay, it's a younger age group, just having pain, maybe it is epigastric pain and simulating as a chest pain. Should not just get deviated like this. So it's important to show to your physician, general physician or the nearest hospital, and do all these things which I was mentioning you. The next common emergencies which we all incur is stroke. So what do you mean by stroke and how do you diagnose it? It is a simple one. Whenever a patient or a person is speaking to you normally, suddenly he flutters or he speaks irrelevantly, or when he was walking normally and suddenly falls down, or he flutters, he is unable to walk properly, or if you ask the person to lift both the arms equally and one of the arm drips down, or a patient's face can become deviated. So one of these 4 symptoms are there. That is one of the most important sign for a physician to identify it as a stroke. As a common man, one of these 4 symptoms are there means you have to think that the patient is having stroke. And don't think that there is no treatment for stroke. Stroke is also a treatable condition. So within 3 to 4.5 hours, the patient has to be taken to a nearest hospital where a neurologist and a CT scan facility is available, so that a CT scan is done for the patient and the neurologist identifies whether the treatment can be given. Like myocardial infarction, the stroke treatment is also similar. They give the medication for them. There is a block in the vessel. So they give the medication to break open the vessel, and so that the blood vessel is freed up and the blood starts moving into the brain. So this is how important thing a common man should know and understand. And the other common symptom, especially in these particular season, that is August to January, it is very cold. Let it be in Bangalore or any other place. And especially in metropolitan cities, we are very, very commonly exposed to dust particles. So what are you finding out? It is called as a bronchial asthma, which is very common illness in the urban areas these days. They say that in the next 3 to 4 years, this will be one of the commonest cause of death. 1 in 4 patients can die because of a COPD illness or a bronchial asthma illness. So what as a common man has to do? Whenever a patient is taking deep breaths and is unable to breathe properly, or you get a sound, some kind of a sound, whistling sound, which you have unheard of it, that means that a patient has developed asthmatic attack, or maybe in a bus or a car or a train. So in these particular situation, usually the patient will be having something called as a nebulizer. So you have to open it and press near the patient so that he can take a puff into the mouth, or he can inhale it so that it will relieve his symptoms and that will reduce his breathing efforts. So this is how a common man has to know whenever such kind of illnesses are there, when they see, and they have to act fast. When you act fast and you become the first doctor between the bridge between the hospital and the patient. So you're going to bring the patient at the golden hour or platinum minutes to the hospital, and they've been getting the proper treatment at the right time, at the right place. That is why we at Narayana are best equipped to treat such patients in the golden hour, whatever we say.